Mesothelioma is relatively infrequent, but it's had a lot of publicity, and people don't really understand the nature of the disease and why it's so concerning. Mesothelioma is almost exclusively related to some version of asbestos exposure. Asbestos is a mineral that's inhaled in kind of small, pointy fibers that are inhaled into the lung, which can either do damage to the lung or the lining of the lung. When it damages the lining of the lungs, sometimes the cells change and become malignant, and you get this unusual tumor that involves either the lining of the lungs or the lining of the abdomen. By the time it's discovered, is often fairly extensive. The other issue that makes mesothelioma rather difficult to diagnose is there's a long so-called latency period between potential exposure and ultimate diagnosis of disease. It can be 35 years, so sometimes you can't identify the asbestos exposure in the past, although there's a strong likelihood that it's been there. So the onus is really on the physician to dig deeply in the patient's either occupational or environmental history to see if you can pick up that asbestos exposure.